Welcome to UNCAGED. Today we're speaking with Kimberly Tucker. Kimberly is the CEO and founder of K&C Solutions. So we're going to be talking about a lot of stuff happening with medical providers and empowering them to really grow their businesses. Kimberly, tell us a little bit about you and your career.
Absolutely. Thank you so much for having me on here. I really appreciate it. So it all started about 6 years ago. I founded K&C Solutions, and it really came out of the just a passion to help healthcare providers. I have noticed how they're not really given a choice whenever they come out of medical school. They either have to go work for a health system, which they're told what to do, when to do, and how to do it. And then, or, they have the option of opening a practice and being expected to know how to run a business and make it successful, which isn't fair. And so that's where everything really kind of started for me. And I kind of realized that working for a corporate company wasn't the best option for me. I've always kind of been an entrepreneur. And so I was excited to roll up my sleeves, start something, make a bigger impact, be a part of something bigger than myself.
So, Kimberly, I'm excited to learn more about kind of the details of K&C and the work that you do. You're absolutely right. Small medical providers, even big ones, really need a lot of assistance in mapping out how to grow that network and their business appropriately. So tell me more about K&C and its pathway over the last 6 years.
Absolutely. So, like I said, we started about 6 years ago, and it really just came out of a need that I really saw. So, when we go in and we speak to physicians or organizations, we come in with a listening ear. We come in to really understand where they're at, where they want to be. We provide a roadmap to help them get from where they are to where they want to be, kind of bridging that gap. Again, they don't really know all the intricacies of running a business. And so what we do is we come in and we listen to what their needs are. We listen to really get an idea of where they're at, and then really start focusing on solutions, giving them kind of a playbook actually, to help them get to where that they want to be. And it is a la carte. They don't have to have every single piece. They can start with one thing and then they can add multiple other pieces as they go. But it's really to help encourage them, to empower them, educate them, and then just be alongside them as they continue in this journey of owning their own practice and trying to be successful, while they, do everything from taking care of patients, learning all the new pharmaceutical drugs that are coming out, all the continuing education that they have to do. And so the main focus is just allowing them to focus on patient care, which is why they went into medicine in the first place, not to run a business.
Yeah. So, I have several friends that work in the medical profession, and certainly the thing that they always tell me they struggle with is the business side of things. But right now, what are you finding are the kind of key issues that they're coming to you with?
Sure. That's a great question. 9 times out of 10, they don't actually know what the problems are. And it's really just really digging deep and asking a lot of questions. It typically comes down to billing and coding is where they struggle the most, because you can your business is going to, sink or swim on billing and coding. If you don't have the proper team that is working alongside you, that is educated, that's up to date on all the CMS updates, then you're going to struggle a little bit. You have to make sure that you have the right team that is ensuring that you get the proper codes, the proper documentation for each individual insurance company, because they're all going to be a little bit different in terms of what they require. And so if you have the right team with you, you're going to do well with billing and coding, and then your organization, your practice will be more successful.
Yeah, I think that probably for general customers out there, the complexity that we all experience just on managing healthcare as an individual. Imagine you're a doctor and you're dealing with these issues. It's just the complexities are exponential and
Absolutely.
quite challenging. So, I mean, it's been an interesting time, Kimberly. I mean, certainly in the medically related professions over the last, I'd say, 3 years as we've gone through COVID and now coming out. What are some of the key trends that you're seeing in this space?
So there's a lot of challenges, yes, within the healthcare space. I think we're all kind of aware of that. There are staffing issues, a lot of individuals leaving the healthcare space in general. And that's definitely something that is trending in the wrong direction.
Mm,
But also at the same time, implementing ancillary services into practices and healthcare organizations to help alleviate some of the burden of the financial the burden that has come across because of whether it's staffing issues, whether it's COVID, whether it's multiple different other things. If implementing the right ancillary services into the organization is done appropriately, there can be a little bit of a balance and a little bit of alleviation when it comes to the financial aspect.
yeah. And I mean, it's a really interesting profession. I know that depending on the day, I'll talk with medical professionals, and there's a lot of excitement on some of the new things that are coming out. And I know that there are a lot of folks that work in the nursing world that are really concerned about the shortages that we see on that front, potentially down the road. But I mean, with all of this change, tell me a little bit what drives your passion for this space. What brings you, I'd say, that kind of broad joy of waking up in the morning and getting on.
Absolutely. So it's really making an impact. Watching, physicians go from struggling to thinking that they're going to have to close their practice to go work
Mhm.
for another organization. And while it's not an overnight fix, obviously they didn't get there overnight. It took years of, unfortunately, mismanagement or just having maybe the wrong people in place. And so it does take time and it is a process. But what really gets me up in the morning is knowing that I will be able to make a difference, or our team will be able to make a difference in the lives of so many, because it doesn't just impact the physician and their practice. It's a trickle down effect. It affects every patient that comes to that practice, because if they had to close the doors, then of course, those all those patients have to find another provider or go to a healthcare system that, unfortunately, the patient isn't it isn't at the heart of the organization. Unfortunately, it's the bottom line to most
Right.
healthcare organizations. And while I think that, obviously health systems have a time and a place, I think that having independent physicians that are able to thrive in this environment is a key to success for our healthcare environment as a whole.
Yeah, no, I think it's a wonderful point. Certainly, anything that kind of helps out on that critical grassroots level that allows independence to survive and to work with the broader ecosystem more effectively is really one of the keys to, I don't know if we say fix, but improving where we are today.
Yeah, for sure.
Uh, so, Kimberly, it's been, as I said, a bit of a roller coaster in the medical world. I imagine you were probably peppered with millions of questions over the last couple of years as people work their way through the pandemic and the post-pandemic era. But now here we are in 2023, and certainly 2023 holds its own economic challenges for everybody. But what are you seeing on the landscape in the near future?
So I am working on a project that is super exciting. I can't share all the details yet because it's still we're still ironing out a lot of the kinks, and so
Mhm.
but there's a lot of good things on the horizon. So my goal, honestly, is to change the culture of healthcare. I want to create the Chick-fil-A of healthcare, and I think that we can do it. We have to have the right team. We have to have the right people, like-minded, individuals striving for the right things. And so
Mhm.
this project that I'm working on is up and coming. It's super exciting. It will be first, so it's right now in another market. I'm working
Mhm.
on bringing it here to my market in Oklahoma, and then surrounding markets as well. And so basically what this will allow physicians to do is we'll give the physicians all the tools and resources for them to be successful. We'll do the management of the business side, and they can just practice medicine without being an employed physician of a health system. Everything is cyclical. I think that right now is a pivotal time in our healthcare industry. And so it gives us a lot of opportunity to speak to those physicians who are great physicians who just want to practice medicine, who just want to take care of patients, and not have to worry about that business side, but still make a good living, because it is absolutely doable. It's an opportunity for all of us to come together, kind of as one and an organization, and really make a difference. So I'm super excited about the future.
Yeah, that sounds really interesting. And it reflects, I would say, something that we're seeing across other business verticals as well. This need to apply technology and new thinking to offer the professionals flexibility, the customers that same flexibility, whilst also not losing that level of expertise and connectivity. So it sounds really, really interesting what you're doing, and I can't wait to hear more, Kimberly. We'll leave
No.
the audience, audience in suspense. But in the meantime, if someone wanted to learn more about what you and the K&C Solutions team are up to, where's the best place to go?
Absolutely. So they can go to my website. It's www.kcmedsolutions.com, or they can send an email to info@kcmedsolutions.com. Those are going to be the best ways to get a hold of us.
Excellent. Well, thank you so much for being on Uncaged today. We've been speaking with Kimberly Tucker. She is the founder and CEO of K&C Solutions. As we all know, the healthcare space is going through a moment of change, some really, really exciting avenues for all of us to explore, and some real challenges. And so, Kimberly, it's been great talking with you today, and very excited to hear this new announcement at some point soon, but also very excited to hear about what K&C's been up to. Thank you so much again, and we look forward to having you back.
Thank you so much. Have a great day.
Cheers.